Hi, this is Jack Cush coming to you from Madrid in EULAR 2019. I want to talk to you about a presentation I saw today, OP0183. The title of the presentation was Efficacy and Safety of Riociquat in Patients with Early Diffuse Systemic Sclerosis and Interstitial Lung Disease, or ILD. As you know, this is sort of a difficult disease, difficult manifestations to treat, both the skin and the lung. And the Riociquat actually is being used because it's an anti-proliferative agent that has been approved for use in some other fibrosing diseases. It's thought to have some anti-inflammatory potential, anti-fibrotic potential. It's not been used previously. It started to have some studies recently, and now we have some clinical trials. This one's called the RISE, RISE-SSC study, and I think you'll find it sort of interesting. It's a one-year study in patients, 121 patients with systemic sclerosis and relatively early systemic sclerosis within the first 18 months. They had to have a modest amount of skin involvement and preserve lung function. So they had to have a modified rod and skin score 10 to 22 and preserved lung function, meaning FVC and DLCOs above 40-45%. And then they were randomized to receive this drug. Now the drug was given in everybody the same way, and there was a placebo control here. The number of patients in the trial who actually had some form of interstitial lung disease was about 20% by 3 different definitions of interstitial lung disease. And so they went ahead and they treated them with Riociquat. And the primary endpoint was the skin outcomes, the modified rod and skin score. But it failed to achieve that. But what it did show was that those that were on placebo had really no change, kind of different than most studies where they show skin scores are always going up, but there was no change here. And there was a trend towards decrease in those that were on Riociquat, except it didn't meet significance, and it had a p-value of 0.08, and that wasn't quite good enough. But they also looked at secondary outcomes, including lung function. And this is where things got interesting. And when you look at all patients in the study, 121 patients, it was in favor of Riociquat, but again, not significant. But if they only looked at the subset who had interstitial lung disease at entry, by one of 3 different definitions, they showed highly significant reductions in FVC as the main measure that they use for decline in lung function from ILD. So it was significant for the lung, and it was significant in this one-year study. There were no new surprising side effects, which is an issue in this study because it looked pretty good and pretty safe. However, in another study they have going on, they had some cardiac issues, some death issues in lung patients. That's being sorted out. Didn't seem like it was an issue here. So we have basically a new therapy that is potentially of use, and we'll probably go forward with further studies. This is sort of in line with what we've seen in other studies recently, where it's really hard to show improvement in the skin, but if it's a good enough drug, it'll actually affect the lungs positively, and this is what's happened here with Riociquat. So it'll be interesting to see where they go with this going forward. That's it from EULAR in Madrid. Tune in for more videos from Room Now.